Good evening, friends. I'm Dr. Mukhmohit, and I'm here to share with you an important update. That is, Government of India has come up with a new GDM, that is Gestational Diabetes Mellitus Screening Guideline. So I'll be just sharing with you the new Gestational Diabetes Mellitus Screening Guideline issued by Government of India. Uh, First thing first is that we should know and we should understand what is GDM for. Like, why do we do a GDM? We all know what is gestational diabetes mellitus. It is detection of diabetes mellitus during for the first time during the course of pregnancy. So we are scared of diabetes mellitus. We are scared that most of the pregnant mothers currently in India would have more kind of diabetes because we already are prone to have diabetes and we are a diabetic genotype. So basically, why the government of India is promoting this GDM screening is that we are scared of some maternal problems, that is the maternal complications, and we are also scared of some of the neonatal complications. So what are the maternal complications we are particularly scared of? We are scared of abortions. We are scared of like GDM is predisposing to polyhydramnios, predisposing to preeclampsia, and predisposing to other complicated labor like prolonged labor or obstructive labor, obstructed labor. So these are various complications which might occur from the maternal point of view. From the neonatal point of view, it's like intrauterine death. We can have stillbirths. We can have stillbirths, increased congenital anomalies, and things like this, and neonatal hypoglycemia. So these are our most important problems that we are facing currently with gestational diabetes mellitus. For that reason, the Ministry of Health and Family Welfare has come up with the GDM screening guidelines, which I'm going to share with you right now. The test of choice for GDM screening is 75 grams glucose via the oral glucose tolerance test. Now, 75 milligram glucose is given as one step procedure in India. It is given as one step. It is recommended by the FOGSI and the WHO, Federation of Obstetrician and Gynecological Society of India, one step procedure. That is after 75 milligrams giving glucose, irrespective of the fasting state. So irrespective of the fasting state, we will give 75 grams of glucose, followed by that 2 hours, followed by that we'll check the blood sugars. So 2 hours we will check the blood sugar. If the value is more than 140 milligram per deciliter, it is GDM. If it is less than 140, it is not GDM. So this is what is the diagnostic criteria. So the diagnostic criteria for GDM is OGTT, one step, 75 grams of glucose. There's another change to it. The most important change is earlier you might be knowing that the GDM screening was done till at what time? It was done at 24 to 28 weeks of gestation. Now please remember, the GDM screening is done at the first visit. It is done during the first contact of a female, so during the antenatal care. So please remember that as soon as possible, or on first ANC visit, the GDM testing is done. So the GDM testing is done on the first antenatal visit. In case this GDM positive, that is fasting blood sugar more than 140 mgdl. In those cases, we need to start MCQ. We need to start medical nutrition therapy plus lifestyle changes plus exercise. So now this female will be advised for exercise, medical nutrition therapy, and lifestyle modification. And that is in case we have at the first contact at the 12 weeks. So usually the first contact is recommended by Government of India at first within the first 12 weeks of pregnancy. So at the same time, we'll do the GDM screening. In case that female is not like the fasting blood, the 2 hour one step OGTT is less than 140 mg per DL. Now in that case, now this female will be subjected to the pregnancy will go on normally, nothing doing. Now at the 24 to 28 weeks, there is a repeat OGTT using one step glucose. So now try to understand there are two screening tools. One at the first level, first time of contact in pregnancy, and second again at 24 to 28 weeks. In the second OGTT, it might yield like more than 140 mgdl. In that case, this is diagnosed as gestational diabetes mellitus, and the female is advised again to take up medical nutrition therapy, lifestyle, or exercise. So the female will take up lifestyle or exercise. So in this case, in case the OGTT is negative, in case the OGTT is again less than 140 mg per DL, now in that case the female is recognized as GDM negative, and the pregnancy has to go on as a normal case. Now this guideline is not yet over, so we have seen just a quick recap. First, GDM screening is done as soon as possible. In case the female is GDM positive at that time, we will subject the female to medical nutrition therapy, lifestyle modification. In case it is not GDM, not criteria of GDM, so therefore this female will be subjected to OGTT again, repeat OGTT at 24 to 28 weeks of gestation. Again, in case the female is more than 140, she goes back to medical nutrition therapy. Less than that, it is GDM negative. Now, medical nutrition therapy is given for 2 weeks. It is given as a trial for 2 weeks. In case after 2 weeks, we will have a repeat test done. So after the repeat test, in case the fasting blood sugar, the OGTT is repeated again. Now in case the OGTT is less than 120 mg per DL, that means the female is going good. So she will stay with medical nutrition therapy. So, but in case the OGTT one step is more than 120 milligram per deciliter, now in this case, the female needs to, it means simply that the medical nutrition therapy is not working. In case it is not working, she is subjected to insulin and metformin. Yes, it is metformin. So MCQs on this, metformin. In case metformin is given only after 20 weeks of pregnancy. So after 20 weeks of gestation only we can give metformin. However, the drug of choice remains insulin. So if the female is okay with insulin at whatever gestation age, answer is insulin. But in case the female is not okay, she's not agreeing to insulin, metformin can be given only after 20 weeks of gestation. So in case it is insulin, it is given in what format? We give like now again there is a guideline in case of insulin. So let us see how to start with the insulin therapy. So insulin therapy in the GDM, insulin is given according to the blood glucose. So if it is blood glucose is 120 to 160, if it is 120 to 160, the insulin given is 4 units of insulin. If it is 160 to 200, the insulin given is 6 units, and if it is more than 200, the insulin given is 8 units. So the insulin will be given according to the blood glucose level. This is according to the blood glucose level. Next, once we give this insulin, the blood glucose level has to be checked every third day. So on third day, the female will get you will get again a repeat OGTT test done. In case the fasting blood sugar with insulin, now with insulin, the criterias are keeping on changing. So at first we started with 140, less than that, more than that. To start insulin, the criteria was less than 120, more than 120. Now, when the patient is on insulin, if the fasting blood glucose, if the fasting if the fasting blood glucose is less than 95 and the postprandial blood glucose is less than 120, that means this insulin is working. So you just continue insulin. You continue the insulin. In case the fasting blood glucose is less than 95 and the postprandial blood glucose it is more than 120. Now in this case you keep the dose same, you keep the insulin same, and you just increase 2 units. You increase 2 units pre-breakfast insulin. So pre-breakfast we increase 2 units before the breakfast. All this insulin, please remember, all this insulin is given as how? This insulin, the whole dose, 4 units, 6 units, 8 units, it's all is given as single dose before breakfast. So all this is given as 30 minutes before breakfast, single dose. It is given as single dose before breakfast. And third scenario, in case the fasting blood glucose is less than 95, less than 120, less than 95, more than 120, or if in case the fasting blood glucose is more than 95 and the postprandial blood glucose is more than 120. In those cases, we keep the dose same, but we split the insulin. Split the insulin regime. How? We split it in morning and evening. In the morning, you add 2 units. In the evening, we add 4 units until, and we titrate it. Every third day, you keep on checking insulin till you reach this target of. Every third day, we will check the insulin and till the target of fasting blood glucose less than 95 and postprandial blood glucose less than 120 is not achieved. So that's how we give the insulin therapy. So the insulin therapy is given as, you can see here, as soon as possible we start with the GDM thing, GDM plus or minus, and then we give medical nutrition therapy, and then you have the role of insulin, and then you have to check the insulin back again. So that is what is the GDM update on how to start insulin, how to give out insulin, and what are the things that we need to take care in insulin therapy. So please remember that there's another important, so one was regarding this GDM criteria. There's another important update that I would like to share with you right now is the caseload. How many GDMs we are expecting in our country right now? It is expected that out of all the ANC cases, it is expected that out of all the ANC registrations that we have, it is expected that approximately 14% will be tested GDM positive according to this guideline. So that means we need to know how many insulins we need to be prepared with, how many stillets we need to buy, how many injections we need to buy, how many metformin you need to buy, and things like this. So the caseload, please remember, can be asked that how many percent of GDM is expected out of the ANC registrations. It is expected to be 14%. Out of these 14%, it is expected roughly, these are just rough estimates, around 10 to 12%. So roughly I can take it as 11% will be okay with the medical nutrition therapy, and remaining 3% will actually need insulin backup from the government side. So we need to prepare ourselves for that level of insulin. We need to see how much is the insulin requirement. On an average, we are estimating 5 units. We are estimating 5 units of insulin for every female for around 180 days. So that would be roughly around 900 doses of insulin we are looking at on a country's level. So this is what is the GDM update I wanted to share with you. Just a quick recap of whatever we have done. Please remember that GDM screening is done because of some maternal and neonatal complications. GDM screening, the investigation of choice is one step OGTT. One step OGTT. Don't forget one step OGTT. Fasting blood sugar after one step, like 2 hour blood sugar after 75 grams of sugar, it should be less than 140. This is known as OGTT. If it is more than 140, it is to be diagnosed with as GDM. So in case we get the first contact GDM, you put her on the female onto a medical nutrition therapy. In case at the first level she is not fulfilling the criteria of 140, you subject her to the second repeat OGTT test, that is at 24 to 28 weeks. In case she is less than 140 at the second also, now she is no more GDM. But in case she is positive at the second time, now you need to start her on medical nutrition therapy. If the medical nutrition therapy trial has to be given for how much time? For 2 weeks. And in case it's okay, it's okay. In case it fails, then you need to start insulin or metformin. Drug of choice is our insulin, given as the units you can see on your screen. So after giving insulin, the therapy target is to achieve a fasting blood glucose of less than 95 and a postprandial of less than 120. So that's it for the ANC registration, and that's it for the blood glucose levels that we are basically tackling for. And please remember, universal testing for all pregnant females is now recommended. Universal testing, tested recommended twice, so you can highlight this point somewhere. That test is recommended twice in pregnancy, first at the first antenatal and then at the 75 then at the 24 to 28. So that's important, that if the 2 hour postprandial after medical nutrition therapy and medical management, we start with insulin or metformin. And yes, the ANCs, the recommended 8 ANC visits is recommended in case of GDM suspicion. So in case of GDM suspicion, recommended 8 antenatal visits, 4 additional visits are to be conducted during this antenatal care. So, and obviously I think we all must be knowing this, that GDM pregnancies are usually associated with the delay in lung maturity, and therefore the routine delivery prior to 39, before 39-week delivery is usually not recommended in these females. And lung maturity is in case of early delivery, so there is indication of administration of prophylactic steroid therapy for fetal lung maturity to be planned only if uncontrolled sugar is there or any obstetric indication. Vaginal surgeries, vaginal delivery is the best route during this time, and during gestational, and neonatal monitoring is what is required. So that's all from my side. That's a small update on GDM. I hope you like it, and I wish you all the very best for your upcoming exam. If you like this video, if you like this information, please you can put anything on the comment section, and we are waiting for your answers and for your comments and for your doubts. Thank you so much. Have a nice time.